Good afternoon, everyone. My name is Jessica Butler and I'm the Deputy Programme Manager for the Eating Disorder Quality Network. And welcome to this live event about how services can support carers of people with eating disorders. For anyone not familiar with the network, QED sits within the Royal College of Psychiatrists and sets standards of care for inpatient and community eating disorder services. We then work with members to identify examples of good practice and areas for improvement. We usually offer a series of events and networking opportunities. So in the absence of these face-to-face meetings, the aim of this webinar is to provide a space where we can share experiences and discuss new ways of working. Before I hand you over to Julie Salt and Veronica Kamerling, who will be leading today's session, I've got a couple of quick housekeeping bits to go through. Next slide, please. So the session is a live event, so your microphones and cameras will be turned off. And the session will also be recorded and uploaded onto the CCQI webinars webpage, and we'll send a link to this when it's up there. If you do have any questions throughout today's session, please use the Q&A function, which is at the bottom of the Zoom screen. And if you just put them in there, we'll answer them at the end of the session. If you are having any tech issues or you would like to chat with other attendees of the webinar or just post any comments, please use the chat function, which is also along the bottom of the Zoom screen, and make sure your comments are going to all panelists and attendees. And finally, if you would like to present a webinar with us, or if there are any other topics you would like to see us cover, please email our general inbox and we'll get back to you. So our first speaker is Julie, and Julie has had 5 years experience of being involved with the college as a care representative on the QED and Working Age programs, and is also on the QI committee. Julie has 3 daughters, 2 of whom have eating disorders, anorexia, bulimia, and its comorbidities, including OCD, anxiety, and depression. And this has spanned over a decade, and they are both on their own individual recovery journeys. And our second speaker is Veronica. Veronica has been involved with the college for 17 years, representing carers on a variety of projects. And for 7 years, Veronica has been a carer representative with QED. Veronica has 3 children, a son and 2 daughters, and both of Veronica's daughters had an eating disorder. One had anorexia and the other bulimia / binge eating disorder, and they are both in recovery, married, and with children. So today, both Julie and Veronica are going to talk about their experience of being a carer of a person with an eating disorder during lockdown and how services could improve their support of carers. So now I'll hand over to Julie, and if you've got any questions for Julie, please pop them in the Q&A box and we'll discuss them at the end of the session.
Okay. Thank you, Jess. Okay, good afternoon, everybody, and welcome to this live webinar. If anybody had said to me probably 6 months ago I'd be presenting in a global pandemic about my experience, I wouldn't have thought it was real. But here I am today to share some of the lessons that I've learned and some of my personal experiences, and also the experience of others through forums and support groups. So next slide, please. Okay. So I don't think there's anybody globally that has been failed to have been impacted by the unprecedented COVID-19 virus. It's created not only global anxiety, but on all of our everyday lives, whether we've been key workers, whether we've been personally touched by COVID. It's also had an unprecedented and exasperated effect on families, not just people with eating disorders, but also it's created additional fear and anxiety for both the carers and their families. Okay, next slide, please. Okay, so I've put together a series of slides and thoughts and reflections about what my personal experience and my daughter's. So what I'm going to talk about, the challenges faced supporting loved ones with an eating disorder. I'm going to start in a moment looking at the difficulties my daughters face, because unless I start with their experience, any sort of tips that I want to share, what's been helpful, isn't going to be as well received if I don't try and understand what that lived experience is like. To be in somebody else's shoes, I think, is key to working with people in any profession, actually, but particularly with eating disorder. And I also want to share some of the things that helped me, some of the things that worked well, maybe not consistently, and sort of finishing off with a few suggestions for services and potential adaptations to support carers. Okay, thanks. On to the next slide. Okay, so I asked my middle daughter to, as part of this presentation, to try and represent what having an eating disorder during COVID-19 looked like. And this is her representation of it. Okay, so you've got the unknown, anxiety, need for control. Okay, and we've all, I'm sure, faced the empty shelves in the supermarket. Next slide, please. Okay, so the difficulties I faced. Okay, I remember getting a phone call from my daughter probably about the second week in March. I think it was a few days before lockdown, because she'd been following the news sort of morning, afternoon and evening. And she has also, alongside her eating disorder diagnosis, she has OCD. And this was actually beginning to take a grip. I hadn't realised how affected she was at this time. So we had a long conversation about what was best, because she actually lives outside the area, and she was debating whether it was safer for her to stay where she was, because it meant there was no germs coming into the flat. So she personally experienced this germ phobia, and I eventually picked her up the next morning because she decided that was for her. She was very, very anxious. And somebody who has OCD type behaviours anyway, couple that with not being able to buy antibacterial wipes, and not being able to buy hand sanitizer. It was a real dilemma. And when she came home, she actually relayed that she was probably getting through about 10 packs of antibacterial wipes a day. And that's when I realised just what, how significant this was for her. And then we've all experienced this, the availability of food supplies and being limited in terms of what we can buy in the supermarket, especially in the early days of COVID and lockdown. And social anxiety, panic buying. I got drawn into that as well. And also for people with an eating disorder, all of a sudden their movements were being restricted. We were being told what you could and couldn't do. And underlying all this, nobody had ever experienced this before. And as parents, carers, we weren't able to say when it was like to end, because we just didn't know. So next slide, please. Okay, so coupled with these anxieties, there were also the obvious ones, such as disruption to services straight away, almost no face-to-face sessions, no therapy sessions, and this certainly led to increased isolation. And not only that, there was a bigger picture out there. People that I've been in contact with, other carers, suddenly overnight, perhaps both, if it was a two-parent family, both of those actually lost their jobs, or there was anxiety about redundancy. So there's lots going on sort of in the family environment. And also for myself included, there was a lot of work, and it's associated, it has an impact on self-esteem. And the big question was about how do you balance all of these needs? And, sort of, there was all these questions about how long was this going to continue, because we ourselves couldn't give that reassurance, because we were all experiencing it for the first time together. So what helped me, I must say I wasn't always very good at this, staying calm rather than getting drawn into the frenzy. Not always easy to do, but on reflection, that was perhaps really helpful. I did start to make use of the collective knowledge of peer and online support forums, sort of Beat. I've got a Sanctuary online room on there. Feast, that's a global network. There was a community, or there is a community pandemic support for anorexia and bulimia care. And really important for me was making use of skills-based communication skills, using practical skills on a daily basis. Okay, and so on to the next one. Next slide, please. So, okay, so self-care, and again, I was really poor at this a lot of the time. But it is really important to reduce your own stress level. I found that planning meals ahead was really useful because shopping took 4 or 5 times longer. And also sort of thinking about other things, making plans for the future, either together or individually. And I think we all started using all the technologies such as Zoom and Teams in a work scenario to connect. And certainly sort of through local services, there were some online sessions. And taking food distraction, and that's probably an obvious one for all of the times as well, but taking the focus off food, spending that time outdoors, that was a real, I found that a real positive benefit. Toolkit, using communication strategies. I found that was something that I could use every day rather than just during COVID. And trying to establish a new kind of structure and routine, partly to deal with change and distraction and preventing boredom at times. And it just had a knock-on effect for myself as well. And also, I mean, I've talked about using some of the technologies, Zoom, but actually the other side of that is about being mindful about how much social media we do use, and the fear that can generate. It needs to be a positive experience and purposeful, and I think that's, sort of in moderation. As time went on over the initial few weeks, it was really helpful to try and sort of talk about, actually, well, let's just listen to the news once a day, rather than everybody's perceptions about what's going to happen, because I think I found that just added to anxiety levels for everybody. Okay, thank you. Next slide, please. Okay, so my suggestions for services. Now, this has come from not just my own experience, but from shared views from other carers that I've been in touch with or that have contacted me throughout this period of time. And I think probably the most important one for me is recognising the carer as being a pivotal part of what I've called the triangle of care. And in that exists the individual with the eating disorder, the clinical support and the carers, because by and large those individuals spend most of the time with their loved ones, with their families. Something else I think would be really useful, and I've seen it used on some of the QED reviews that I've been on, it's equipping families with this practical skills, communication skills, DBT. I found that really invaluable because it's not just a Covid-19 skill, it's for everyday use. I mean, and some of those skills don't necessarily work every day, but it's certainly a toolkit that I come back to. So therefore, this information and support I think is invaluable for carers. Technology, I know lots of services have embraced technology and they've done ward reviews via Zoom. I took part in one of those and I thought it was really good because it's really innovative and it didn't take as much time up from the clinicians, they weren't travelling as much, but also dedicated access to clinical support. When I was thinking about, what wasn't available, perhaps would have helped me, maybe a session where you could actually contact the clinical team. And also, I think there is a barrier for some individuals who don't want information to be shared within the family. There is it can be done. Obviously, sort of clinicians can share some scenarios where particular skills and approaches have been helpful. And I think that's just as important. You don't have to, sort of betray confidentiality, but I do advise that that's really helpful. Peer support, up-to-date information, online support groups, we've spoken about that. And some of the other suggestions, which are on the next slide, involve asking carers for feedback about their experiences during COVID-19 in particular. I know services are continually asking for information and feedback through family and friends tests. We just go on to the next slide, please. And something that's been suggested to me before is dedicated carer crisis support. And I found it really an interesting suggestion as well. Something that was also fed back to me is when we were all having to negotiate our supermarket shopping times and priority access and so forth for the elderly, the vulnerable and so forth, it was suggested perhaps that sort of carers or those individuals living in the community themselves with an eating disorder could perhaps have priority access to some of those shopping slots. But obviously that would involve some kind of sort of permission, if you like, to be able to do that, something from a clinician. And I thought that was quite an interesting one and perhaps food for thought. Sort of just moving on to the next slide, just to sum up some of those things that have come from other carers contacting me during these COVID times when they've been supporting loved ones with eating disorder, and from my own experience. The skills-based communication skills, they were the most valuable of everything, because it wasn't just something for COVID. And very importantly, I'm a real strong advocate of this, is that I know what helps me, whatever point of recovery my daughters are in, and this is echoed from lots of other carers that have been in touch with me. If they are confident that their loved ones are getting the right support at the right time, and it's not about firefighting, with bespoke eating disorder staff or trained staff in the community. I think this has been perhaps an issue, perhaps for some of those who've contacted me, particularly in the community. And that goes a long way, certainly to my well-being and other carers, because I'm not thinking that, well, actually, this is slipping back, or what do we do? I'm confident that that team it has got a plan in place, and sort of my daughters getting the very best treatment possible. I think going back a couple of days, I mean, this what has been fed back, because my daughter and myself, we recognise that she's really struggled over these last 3 months, and we're working on portion size. So that's something that we're working on at the moment, but it's a little bit challenging because the CBT support, she's actually been told that actually an eating disorder is a physical problem rather than psychological. So that's perhaps just amplifies some of the battles. And my concern is that moving forward, we're going to see an increase in referrals for eating disorder support. We know that BEAT inquiries, referrals have gone up by, I think it's 73% over the last 3 months. And there's certainly going to be an impact on those community patients that perhaps have regressed a little bit and perhaps need support to get back to where they were before face-to-face therapy finished. So, and just really to finish off, so what I've spoken about, just to summarise on the next slide, is I've talked about the challenges that I experienced with supporting both my daughters with an eating disorder during coronavirus, and importantly, the challenges that they face, because that's helped me to understand, where they're coming from, what helped me, what worked well for me, and perhaps some suggestions, ideas, adaptations that can be put into place to support carers in general. And that's my experience sort of so far. So I hope that's given you a little bit of insight. And I think we're taking questions at the end after Veronica's spoken.
Yeah, thank you so much for that, Julie. That was, yeah, really interesting. Thank you for sharing your experiences and your daughters as well. I'm now going to pass over to Veronica, who is going to share her experiences of being a carer of a person with an eating disorder during lockdown.
Well, good afternoon, everybody. I'm very happy to be here. It's always a very unusual experience talking to people who you can't see. But anyway, here we go. I'll do my best. And first of all, I'm going to talk about tips for carers. So if there are carers out there, this is what I feel has helped, certainly from my own point of view. And if I'm talking to professionals, then this is what could be suggested to carers. And the first thing, of course, always is carers sort of need to look after themselves. And I know this is always very difficult to take on board when other people in your family are ill. But it is the old oxygen mask that you can't help people unless you're sort of okay yourself. And I think one of the things is structure of the day. I am incredibly bad unless I have structure in my day. And therefore, during this period, I have set myself goals. I have to achieve one thing per day. Now that can be organizing something in my house, cooking some meal, gardening, or whatever. But setting a goal and not ending up at the day thinking, where did that day go and what have I achieved, doesn't do me any good. Now, the other thing I think is useful is people taking up hobbies. I'm lucky enough to have a garden, so I do a lot of that. I'm a massive walker, so I do a lot of that. And I do, if it's raining, I do jigsaws, which I absolutely love. Somewhat challenging, but you know, fairly addictive stuff, jigsaws, I find. And communicating with friends. And I know everybody rushed to their telephones when lockdown first started. I have to say it's not my default position to keep ringing friends up, but I do realize that it's extremely important. And I think some carers may feel, well, you know, I've got nothing to say, I haven't been anywhere, I'm just living sort of, you know, arguing with my children or doing whatever it is, and therefore I don't feel I can ring them up. But there's always something to say. It's amazing what you can find to say that you've done if you do ring people up. So I think that is very, very important to stay in the loop. And of course that colludes very much with carers looking after themselves and sort of socializing, obviously when one's allowed to socialize, and taking things one day at a time. I, again, very bad at that. I'm always stressing out about what's going to happen in a month's time, but it's actually incredibly non-productive. I have really benefited from living sort of in the moment and getting day-to-day things done. And I'm going to tell you a rather odd story, but it's about Rosie, my neighbour, who I live in a row of 3 houses, and Rosie, I'm connected to, I'm on one end and she's in the middle, and I'm connected to Rosie. And because before lockdown we all worked, and I didn't see very much of her, and we used to, because we didn't want anyone walking into our house, we used to keep our back doors shut. We've got back gates and front gates. And I said to her at the beginning of this, do you know what I think the really good idea is if we open our gates? Otherwise it's going to seem as though we're sort of keeping people out, and we've got quite enough of that with lockdown. And I can't tell you, such a simple move like that has been absolutely marvelous. I've got to know Rosie much better. We do have a passion for gardening, which has helped. We've had we've had a lot of laughs. And I think the other thing I would always stress is relentless positive thinking. If I had to give one example of what I have seriously found difficult in this pandemic, is the negativity from my friends, the media, you know, television, all that. If I'm not in a good space, that is not helpful. And keeping, if possible, relentlessly positive, and that I know is very difficult. Now, my next slide, so to speak, is tips for supporting carers. So I've had an enormous amount of challenging calls from families that have sort of described the violence that's escalated and the anger which is escalated from the person who's ill. And listening to the stories, it's really heartbreaking. And on Sunday, I had a particularly distressing call from somebody who had sort of completely lost it. And he just couldn't cope anymore, and he was going to throw his whole family out, and he didn't know what to do, and what should I do, and all the rest of it. But that's been a pattern throughout all these months of people not knowing, or when I say people, families, not knowing how to deal with it and what to do. And my own family, my eldest daughter suffers from depression, and she has found it incredibly difficult. She's got 2 very small children, and she's working. And it's been incredibly challenging. And of course, that reflects very much on the whole family. I think a call or a text, if possible, I know that puts extra work on people, but the spin-off of that and the sort of joy that it gives carers, it cannot be underestimated. It's just wonderful to think that somebody is there and prepared to just give an extra few moments to seeing if I'm all right, or carers are all right. Email is fine. It doesn't quite come over as the same concern. And some carers may well be grieving. I have lost friends to COVID, and therefore it's not just, it's all the family suffering from depression and anxiety, not just the person who's ill. I always suggest that people, if they can, join online groups. And I know that there are some online groups there run by individuals, some operating in services. I don't know how many of the services. And I know that, as Julie mentioned, there are charities doing it as well. And I think that is definitely somewhere to point carers to. I'm a huge believer in groups. I think the benefits from groups can't ever be underestimated. And I did run one for 13 years. Now, the other problem that's going to flare up, and it has started to, is post-lockdown. So the fear of going out and socializing, and that is going to be, well, and I think is a real problem. And talking entirely personally, I had calls from friends when we were allowed to go out. And even my own son rang me saying, "Mum, why don't you come over and have a drink?" And I thought, do you know, I actually don't want to go. I have established my life here. I love what I'm doing now. I don't want to go anywhere. It wasn't for fear of the illness. I just re-established a new life and got used to the non-normal, if you like, or the new normal way of living. And I think a lot, as I look around me, I mean, as I hear, I think a lot of people are doing the same. I have families who tell me, "Oh, well, you know, we're not going anywhere, we're doing this." And I think that really needs addressing on how to ease people back into some sort of normality. Now, the other thing is actually when those older children leave home, I don't know how many people think about this, but actually you've been in lockdown for 3 months, and I used to have my children living at home with me when they were ill, and there is a massive void. Unless you've experienced it, you may not be able to understand, because you think, gosh, wouldn't it be marvelous? Well, funnily enough, it's nothing like as marvelous as you think it might be. It leaves a gaping void. And again, the reasons to sort of be supported through this period, just people, you know, helping them through it. And in my view, empathy, compassion, and a listening ear can never be underestimated. And I can't single out which one would come first in a way, but listening is such a gift and is so necessary. And it's just listening to someone and for them to realize that you're hearing what they're saying. And it's a really good way of having services and families communicating much, much better. So I think, and of course there are ways of listening. Reflective and active listening is, I think, sort of, you know, part of the gold standard. So if those were applied, it'd be even better. And staying in touch, just so somebody knows that you're there. I'm not happy to be called. Now, the other story I'm going to tell you is, again, sorry to keep talking about myself, but I mean, a lot of the things that I'm saying are obviously things that I've heard from carers, and that after 17 years of running my own organization, I have, you know, these are what I've said before is reflected in how they think, not just me. But this is a more personal story. And my youngest daughter I dropped her off at an inpatient clinic, and pretty nervous, as you can imagine. And the only things I ever seemed to hear were, well, you can't ring her up, you can't come and see her. In fact, there was not very much that I could do. And it was clear that separation was going to be the name of the game. And I remember leaving the clinic and that heavy door, sort of oak door, slamming behind me. And I thought to myself, do you know what? This must be what it feels like to have children taken into care. And it was the fact that I can remember it, which is now 30 years ago, it had a pretty devastating effect. And the other incident was with my eldest daughter, who wrote to me saying, I don't want to see you because we've got a relationship that is not healthy for my recovery, and I'll be in touch again when I need you. And if you've been looking after people for a long time, that is another bitter blow. It's another separation. So what I'm trying to say about this from those stories is that I can empathize enormously with people who are not living with their children, who are ill and who haven't seen them. And it should not be underestimated at how pretty devastating that is or can be. So in conclusion, I heard from a psychiatrist the other day who, and these were his exact words, that there was going to be a tsunami of mental health illness after lockdown. So rather like Julie said, we don't need to do firefighting. There needs to be an ongoing plan for carers. And I really do think that that is a very serious point. Otherwise, it's chaotic. And for me, I think from all the calls I've had and generally the work that I've still been doing during COVID, I think what it's highlighted, probably more than anything, the real need for carer skills in every service so that carers understand what it is and how they should sort of, behaving sounds awful, but you know what I mean, to when they're with the people with the children that they're looking after, or husbands and wives and brothers and sisters. It really is important. And I had the luxury of learning that lesson. And there is absolutely no doubt, and this applies to both my children, that my children's recovery was definitely hastened by that. You can't you cannot look after people if you don't know what you're doing. My late husband had colonic cancer, and I had a sort of 3-hour training on, you know, what did I do to look after him? And it's really, really important. And another psychiatrist said in another webinar the other day, and I completely collude with this, which is communication, collaborative working, and mutual support. And I've added listening to this again, sorry to be repetitive, is the way to go. And I absolutely agree with that. And just to end on 2 sayings, or 1 saying and an observation, we used to say this in one of the clinics that I was in: if nothing changes, then nothing changes. And I would add to this, please remain relentlessly positive. Thank you very much.
Thank you for that, Veronica. Again, really, really insightful. And I think, yeah, just thank you for sharing your experiences too. We have around 20 minutes for questions. So if anyone has any questions that they want to ask Veronica or Julie, please do use the Q&A function along the bottom of your screen. I don't think we've had any come in yet, but I'll give it a minute or so if anyone wants to write any questions. I guess I did have a question about, so I'm just jumping in first whilst I've got the chance, about the type of support you actually did receive from services during lockdown, and whether it was anything or whether you literally would have left to your own devices.
I'll perhaps start on that one if that's okay, Veronica, because obviously I had, or still have, 2 daughters at home, and I suppose it was a little bit of a different experience really for both, because one is getting community treatment in another neighbouring authority, and obviously by taking the decision to come home, you know, sort of we weren't on the list, if you like, so to speak, for those particular services. So having said that, my daughter does continue to have online dietetic support. She was travelling outside the area 1 day a week because the support isn't there within the community team that she has, and actually she said this would be the most helpful. So that has continued during lockdown, but it's all been on WhatsApp or Zoom, whichever one she uses, and so that's continued. It's been really good. So there hasn't been any care support in that way, but locally, limited. There's been some. It depends on your daughter's diagnosis, and when you've got a number of complex comorbidities, it's not as easy, and it's where you fit. But certainly there's been some numbers to ring, sort of COVID lines, if you like, sort of generic sort of options. But I guess at the end of the day, however unwell, I think we know our daughters, sons, loved ones best. But I would have found it useful just to pick up the phone and say, look, I've done this and it didn't work, what do you think? So just a bit of a, as Veronica said, a listening ear to say, well, actually, yeah, it was okay, you did what you could, and it might work next time. But I suppose limited, but for lots of different reasons.
Yeah. And what about you, Veronica?
Well, I haven't, I mean, this is awful to say, I haven't needed the support. Oddly, I tell you, the support that I've needed, actually, if I was honest, and luckily I do have supervision from other parts of my work, but I think supervision for me was actually crucial in the way my life goes, because my children, you know, have to sort of deal with it themselves now. I mean, and they know how to do that. So it was I had 2 of the worst cases of people who rang me that I've had for years. And, you know, that's difficult to deal with from two reasons. One is an emotional standpoint, and the other is the risk, because you're always constantly aware that you've got to be helpful, but that doesn't require, that requires thinking out and thinking on your feet and trying to say the right things without starting some huge fallout from it. So for me, it's been definitely supervision, the support that I've needed through all this.
Yeah, so similar to Julie, like a listening ear, someone to talk to.
Yeah.
So we have had one question come in about suggestions for inpatient units during COVID. So where visiting has been limited and parents have not been able to practice some of the supporting skills needed for successful discharge home. So I guess what suggestions would you have for inpatient units to help parents?
I know that of one of the local, well, the local eating disorder unit here, in terms of facilitating visits, shall we say, you know, there were lots of restrictions and continue to be. They did set up a gazebo to facilitate outdoor visits, if you like. So that's one practical aspect of it. But I would say it is obviously going to be really challenging during those times, during lockdown periods. Perhaps something could be set up via technology, via Zoom, perhaps if there's a carer lead, perhaps facilitating an online group. I mean, it depends where their loved ones are at in their state, their recovery stage, whether, you know, sort of that would work for them. It could be done on a one-to-one basis, it could be on in a group scenario, but I still think you can keep that connection going. It's like Veronica's already said. It could continue via Zoom. Obviously, it's not the same as practicing skills, you know, sort of with your loved one. But in the absence of that, for me, the next best thing is still keep that learning going, if you like, and that chance to practice some of the skills or ask questions via Zoom.
Yeah. We haven't got any other questions. I don't know if you had anything to add to that, Veronica?
No, only that, as I say, the online groups that I hear about that are being run have been very successful. That is, you know, one way of doing it. So I'm rather like Julie was saying, that if you already run a group in your service, then you just put it onto Zoom.
Yeah.
And for those who've done that, I gather it's, as I say, it's very helpful.
Yeah. I guess another question for me is about sort of the changes that you've had to make due to COVID-19 that you think you'll actually continue with, so you won't go back to your previous way of doing things, or in relation to what services provide. So I was just wondering whether there was anything that you've had to change because of lockdown and COVID-19 that you'll think you'll continue once things go back to normal, when that will be. I'm not sure.
That's a good question.
Yes, absolutely.
I'm trying to think what I have changed. Trying to be more, Veronica's already touched on this, and I think it's a really important skill. It's being in the moment, being mindful. And as much as I like to think I'm more mindful than I am, it's like Veronica's already said, thinking about what's going on tomorrow, next week, next month. And actually, during this period of time, that's all we've been able to do, because we haven't known when we can perhaps, you know, the travel restrictions are going to be lifted and so on. And obviously, it's with us for some time now. It's a different way of living. So because I did actually think during lockdown, as you know, sort of, okay, as this is an unprecedented situation, but actually probably never again would my middle daughter be home for this length of time. So where you can, make the most of it, instead of thinking about, well, when is this going to be reached? When can we do this? And what about this? And I do need to, it helps you take care of yourself. I mean, it's important for everybody to try and be mindful. But I think when you've been in this position of enforced lockdown, you've had to look internally and, because how can we deal with this? And I think that's having that time, a little bit of time for yourself and being mindful, whether you do a bit of meditation. I mean, I've got the Headspace app on my phone, but I can't say that I've actually used it yet. So, but yes, it's something I need to take on board more.
Well, oddly, I've been more relaxed because I haven't felt, well, not so much with my work, which I've indicated has been quite, well, it's been very full on. But interestingly, lockdown has played into my senses of isolation. I have a reputation for being a sort of party lover, and I do, when I get to a party, I love it. But my instincts are to isolate. And this has been a golden opportunity not to see people, which sounds awful. And I know that's the same with people who are not well. So I suppose answering the question from another angle is, what am I going to find that's difficult? Having been so relaxed, it's coming out of my shell, my blanket or whatever it is that I've enjoyed so much, and I am finding it difficult. I just don't like this continuous sort of, what are we going to do? When are we going to do it? Are you doing this? So rather like I was saying in what I said about coming out of lockdown, people not moving out of their houses. Yeah, it will be strange going back to normality when you just haven't really had to do anything for 3 or 4 months. Yeah, so we haven't had any other questions come in, so I think I'll just leave the Q&A there if no one's got anything else.
Question in the chat. Have you answered that one already? Have remote groups?
Oh no, sorry. Yeah, sorry. We've had a comment in the chat about having remote groups with inpatients and day patients has been a great success as day patients were at home. So I don't know if Judy, your daughters have participated in anything like that, the remote group?
Yes and no, because 2 different services. There's been limited opportunity. Again, it's a little bit more complex because they've got different diagnoses and different comorbidities, so and they're on their own different pathways. But certainly one of them has been in touch with the therapist, but not with other patients that I'm aware of or other people in services. So limited, I would say.
Yeah.
In my experience, anyway.
And do you think it might have been helpful if your daughter had participated in remote groups?
Yes, I do think it would be useful. Because we did have, although that said, there was, we've got a crisis cafe, which obviously wasn't able to open its doors for people in the community, so that they were operating via Zoom. So there has been that general offer of support for people in mental health services. But again, I think any sort of opportunity to connect is really, really useful. It's particularly in terms of, sort of, it's the isolation, because we know eating disorders thrive on isolation, and I think that opportunity to connect is really important. So yes, I mean, that, any opportunity to connect with people, for carers, for inpatients, for community patient, I think it's a great idea.
I think the other thing, I sit in on a webinar with 59 psychiatrists, if you sort of every fortnight, and one of the weeks they were discussing the success of remote counselling and therapy, and they're all quite, I mean, they're all actually very enthusiastic about that. So that's individual stuff has been, I gather, very successful, and they're very comfortable with it, and everybody thinks could well be the way forward, actually. So that's for individuals.
Yeah, that'll be interesting. Yes, so sorry, try to cut us off before. Yeah, I will leave it there. And yes, thank you both for really, really interesting talks and for the Q&A as well.